I'm Dr. Kelly Starrett, co-founder of the Ready State and human performance advisor for H-Wave OTC. Today we're talking about how to better manage elbow pain when that pops up. Now, you can have elbow pain on the inside or elbow pain on the outside, sometimes even where your triceps comes down, but typically people are having some kind of painful symptom on the sides of their elbows. And this is usually referred to as golfer's elbow or tennis elbow, but ironically, sometimes neither golf nor tennis is involved. When you have a painful elbow, you become hyper aware anytime you need to flex or grab something, that thing becomes an issue. And oftentimes what we don't appreciate is that there's a lot we can do to give ourselves some relief and help create an environment where we can see better healing. So today what I've done is I'm going to show you how to set up pad placement to get some relief. And there's some choices here. Now, what I'm going to do here is put one pad above or below where I have my symptoms, and one right above where I have my symptoms. So if I was having some pain, let's say on the lateral aspect of my arm here, what I can begin to do is turn on the device, follow the lead, go into high frequency here. And what's going to happen now is as I dial this up, I'm going to get a comfortable buzzing between the two pads. Now, what's important to understand is if wherever the pads are, I'm going to get the buzzing or some sensation of some relief here, and it doesn't take very much. If I turn it up where I start to lock down, I probably exceeded what I need to do. So I just want to turn that up right before I start to get a good solid muscle contraction. And then, of course, I can always readjust the pads to change or give myself a different experience of what's happening. You might be able to move the pads, but if that makes you uncomfortable, turn it off, move the pads to a different place, and then go ahead and turn it back on. So what's nice now is that this gives me some real opportunities to give myself some on-demand pain relief. And I can use just one pad high, one pad below it. Again, wherever the pads are going to go gives me sort of a direct line of current. So if I was trying to manage a painful elbow through the actual elbow joint, I could do the same thing here where I just dial this up and go ahead and put one pad on one side, one on the other side, and run a little current right through. And what's nice now is that I'm going to get some relief. I'm not going to be able to hear, or my brain is not going to be able to interpret what's going on at this elbow. And what I want to do is run this for a max of about 45 minutes to an hour. And what we're trying to do is make sure that I'm not having some additional skin irritation underneath or any skin irritation underneath. Once I've done that, I'll probably get many hours of carryover relief, which means that if I know that I need to go use my arm, I might use this before, and then that sets me up to be able to go into my environment or play my sport or do my job or carry my child or do whatever I need to do in my functional living. I can repeat this multiple times. Typically, we like an hour on, hour off, just because we don't want the skin to get irritated under the pad. But if you're not seeing any skin irritation, which is mostly common, then you can definitely do an hour on, hour off, or wait until your symptoms change a little bit and say, hey, I need another dose because I'm going to go. Remember that the goal here of using high frequency is to get some pain relief so that I can do something, so that maybe I can fall asleep or I can feel comfortable or I can get in my activities of daily living. I do have a whole nother pad setup, so if I needed additional current through here, I definitely could do it. But this also sets it up, and as a reminder, I can set this above and below, and I can set it on low frequency here. That means one lead can be pumping and decongesting, getting this non-fatiguing muscle contraction, and the other lead can be giving me some pain relief. So remember, I can manage my pain on demand, and I simultaneously can work to create a healing environment for these tissues at the same time. Running one high or one low works wonderfully. And again, the idea here is let's create a better healing environment so that we can get about managing the irritation that's causing or getting my brain to perceive my elbow as a threat. And secondarily, let's get some pain relief so that we can get on with our activities of daily living.